Act and resources to support any questions on this topic. Just a little bit about Ruth. She's the Associate Director of the National Network of Libraries of Medicine at the Greater Midwest region, which is located in the Library of the Health Sciences at the University of Illinois, Chicago. She manages a 10-state library network with more than 1,100 member libraries, including many non-medical libraries such as public libraries. Before moving to Chicago to take on her current position in 2002, she was a librarian for 32 years at Columbia Hospital in Milwaukee. She is a fellow and past president of the Medical Library Association and lead author on the first edition of the MLA Guide to Managing Healthcare Libraries. She's been a member of SLA since 1972 and has been giving presentations on the Affordable Care Act for a variety of librarian audiences, beginning with the ALA meeting in Chicago last summer. So with that, I will turn it over to Ruth to jump into her presentation.
Okay, thank you, Kara. I hope everyone can hear me. I'm going to get moving and assume that everyone can hear me, but Kara will let me know if there's any problems with audio. So I'm, as Kara mentioned, I was a hospital librarian for 32 years in Milwaukee, and I actually joined the Special Libraries Association before I joined the Medical Library Association, although I've been a lot more involved with the Medical Library Association over the years. But I have a real fondness for SLA. I was part of the Wisconsin chapter for many years. My primary focus today will be on resources that librarians can use for themselves and their families, as well as ways that you could partner with community leaders during the rollout of the Affordable Care Act, or to assist any library patrons that you get that ask questions about this. So I'm going to start with a definition of health insurance literacy. This phrase is increasingly being used to recognize that consumers have serious difficulties understanding and using health insurance. These health insurance difficulties take a toll on consumers' health and their financial well-being, and they have cost implications for healthcare plans and for the nation as a whole. A health insurance literacy expert roundtable that was sponsored by the Consumers Union, the University of Maryland, and the American Institutes of Research in November of 2011 came up with this definition, which is that health insurance literacy is the degree to which individuals have the knowledge, ability, and confidence to find and evaluate information about health plans, to be able to select the best plan for their families, and also, once enrolled, how to use the plan. So the types of resources that I'm going to talk about today include federal government resources, some local Illinois resources, and some consumer and professional association resources. So to begin with, I'm going to start with sort of a high-level overview about the law. Many of you, I'm sure, have been reading about this in the paper. Unfortunately, there's been a lot more negative publicity about the law and about the fact that we all know that the healthcare.gov website had lots of problems when it first came up. But just to remind you of some of the features of the law, it really provides stronger consumer protections. It eliminates, for example, the lifetime limits that are on many people's insurance companies or insurance policies. There's no more denial of pre-existing conditions, and it keeps adult children on parents' plans until the age of 26. There are some lower cost and higher quality components to the law. For example, free preventive care is one of the essential services that insurance companies have to include now. It closes the donut hole, the famous donut hole for drug coverage. It ties Medicare reimbursement to hospital readmission rates. So hospitals, there are some things that hospitals have to do in order to make sure that they continue to get reimbursed at the rate that they want to be reimbursed for their Medicare patients. It also has some tougher enforcement to stop health fraud. Also, there is better access to health insurance as a result of this law. 80% of every premium dollar has to go to care, and there's a lot more transparency in the marketplace because of the law. So what has changed? The next couple slides will remind you of some of the benefits of the law and what's going to change as of 2014. But before 2014, 3.1 million young adults gained insurance as a result of this law. 34 million Americans with Medicare that already had Medicare coverage are now getting free preventive care. 105 million people have had their lifetime limits removed from their insurance. A lot of these things are things that, you know, many of us, if we work for an employer and we have a good employer-based insurance policy, haven't had to think about. But there are a lot of things about this law that are making a big difference for individuals, things such as these lifetime limits. 71 million privately insured people have gained improved coverage for preventive care. As of January 1st, 2014, all citizens and legal aliens of the U.S. must have health insurance. There will be a penalty applied to the 2014 tax returns for people who remain uninsured. The penalty is pretty low the first year, but it will be going up after that. So they are giving people a little bit of time in case somebody's been living under a rock and doesn't know that there's a law that says they have to buy health insurance. Discrimination due to pre-existing conditions is now prohibited as of 2014. More people are eligible for Medicaid in some states. Illinois happens to be one of the states that has expanded the Medicare coverage. So this will mean that there will be more people in the state of Illinois that are covered. I apologize for those little Skype messages that are showing up. I don't know if you're getting them on your screen, but I'll try to close them if they do pop up. Anyone not covered by employer insurance will be eligible for the new marketplace as a result of this law. Some of the financial benefits. The law was actually implemented in 2012, and so there have already been some financial benefits as a result of this. $1 billion has been returned to consumers in 2012 because insurance plans must now spend 80% of the insurance premiums on health care. So this is good news to us as consumers. And obviously some people have already gotten money back for that. 6.1 million people with Medicare are now being covered for prescription drugs to the tune of an average of $1,100 per person. Beginning in 2014, there will be enhanced competition in the marketplace. That's a good thing. One process, there'll be a single process to determine eligibility for insurance, tax credits, cost sharing, Medicaid, and Children's Health Insurance Program, which is known as CHIP. The premium tax credits become available to increase affordability of health insurance, and those credits will be based on your income level. So low-income people will be eligible for income tax credits, and there will be small business tax credits available beginning in 2014. Right now, the general definition of small business is businesses with fewer than 100 FTEs, but I believe that it's up to the states to the states will be allowed to define that as businesses with 50 or fewer during the first 2 years of the coverage, and then it reverts back to 100 or less. And who knows? It's not out of the question that some of the specific components of the law will be changed. We've already seen some tweaking of the law. The mandate for employers to have coverage actually has been moved back into 2015. So there may be some things that do change as we go along. I mentioned essential health benefits a little bit earlier. This is the list of these are the 10 services that health insurance companies must include on in their health insurance policies. This is good news for us as the consumer because in the past, many of you probably know, some insurers did not include things like maternity care, or they did not include mental health and substance abuse disorder care. Many of them didn't have free preventive services. So there's now a standardization, and a little bit more standardization in terms of what health insurance policies will cover. So we'll jump to the federal resources first. Healthcare.gov is the obvious place that everyone needs to know about. I guess you'd be, unless you've been living in a cave, you've probably heard a lot on the local news and national news programs about the rollout of healthcare.gov. I think many of the glitches have been fixed, and from what I can tell, people are able to enroll in the and many millions of people have already done so. Yesterday, I believe Kara sent out a handout to all of you, a one-page handout called Getting Covered, a one-page guide to the health insurance marketplace. This is an example. I just wanted you to see an example of one of the pieces of literature that the Center for Medicare and Medicaid, also known as CMS, one of the kinds of things that are available if you go to the healthcare.gov website to look for resources. So if you type in healthcare.gov, this is what you get. You get a page that has these three circles. And this slide is already out of date because I printed it before February 15th. If you go on today, it'll actually say enroll by March 15th for coverage by April 1st. So you get these three options. One is see plans. The middle one, the big one, is apply for health insurance coverage, and then the other one is using your health insurance coverage. So I'll go through each of these three buttons. The first one, get plan information. This is what you get when you go to that page. And you're going to be faced with a successive list of questions that will lead you to determine whether or not you are eligible to use the marketplace or whether or not you can get financial assistance for paying for your health insurance. The questions include things like, are you a business or an individual? What type of coverage do you need? Do you already have employer-provided insurance? In what state do you live? How many people will be covered by your insurance? What ages are the covered individuals, et cetera, et cetera. Once you've gone through and answered all of these questions, you'll be able to see what the options are that are available to you from your state. And by the way, there are 6 companies that are competing in the Illinois marketplace. So this is the point at which you would get information about the various products that are available from the 6 companies in Illinois. My apologies to those of you who are on the call who may be outside of the state of Illinois, since this is a webinar for the Illinois chapter of SLA. I will be using some Illinois examples, but much of what I'm saying probably will apply to other states. Illinois is one of the states that has agreed to expand Medicaid, so that's a little bit different than some of the other states in the Midwest, for example, where Medicaid has not been expanded. So there may be some differences from state to state. So if you click on that middle circle, that middle button, the Apply Now button, this is what you're going to get. You're going to get the Medicaid Marketplace page, which is going to give you the choice of applying online or applying by phone. The middle part of that page actually has a nice pictorial that shows what the steps are going to be for people in terms of applying for insurance. So you first create an account, you apply, you pick a plan, and then you enroll. So they've done a fairly good job of doing good graphics on the site. That third option that we had on the home page was an option to about using your new health insurance, and this is sort of organized into answers to common questions that people will have about using their new health insurance coverage. In addition, this section of the website provides information about getting prescription medications, about getting regular medical care, about getting emergency care, and also how to appeal an insurance company decision if you don't agree with it. So this is what you're seeing in this slide is the bottom of the page, and this is actually the bottom of most of the pages, almost all of the pages on the healthcare.gov website. So they're using a common communication box at the bottom of all of their pages that has social media links and phone numbers and information on where to go for additional information. I've circled the little partners section on this page because I want to point out to you what some of the resources are that are available for companies that are partners in this process. So when you click on the partners page, you're going to get 3 tabs, and if you go to the Get Training tab, this is the slide that you're going to see, or this slide depicts what you're going to see. The first tab at the top, the Resources for Assisters, is where, for example, if your company wanted to become a champion for coverage, they could go to that section. And it's also where you can get information about how to apply to become a certified application counselor under the new law. So what you're seeing on this slide, though, is the information that's on the Get Training page. And this has a lot of interesting information like slides with speakers notes and videos and things like that. And I, in fact, was able to go on this page and find material that I could use in for some of the presentations I've done over the last 6 to 8 months. And also, this is where you would find what is in the curriculum for the people who are called navigators or certified application counselors. The Get Official Resources page, which is the third tab on this page, provides additional information on publications, research, widgets, logos, and a variety of other resources that you might find useful if, for example, you were called upon to do a presentation for a local community group or to gather information about the Affordable Care Act. So there's lots of stuff here sort of behind the scenes for people who want the professional materials. Finding help is, there's a variety of ways people can get help. There are navigators. Navigators are organizations that have been funded early in the implementation process to provide consumers and small businesses with assistance. There are at least 2 navigator organizations in every state. If you want to see a link, on one of the subsequent slides I'm going to be showing the link to the website for the organization I work for, and actually we've got a link to the navigator organizations in the Midwest on that page. So if you can't find it anywhere else, you can find it on the National Network of Libraries of Medicine, GMR page. A certified application counselor is an individual that is affiliated with a designated organization who is also trained to help consumers, small businesses, and their employees as they look for health coverage options in the marketplace. The navigators and the CACs must all go through the same training curriculum and must provide their services to consumers for free. So if you do get calls from somebody who wants to know where they can get help, these are the people there are people out there that have been trained to do this, and many of the public libraries actually around the country are inviting the navigators and CACs into their libraries to do sessions to help people actually provide some hands-on help for people to fill out the forms that they need to apply for insurance in the marketplace. There's also a toll-free lines, separate ones for individuals from small businesses, and there is a online chat available, and you can find local help via zip code. One of the links in the healthcare.gov homepage takes you to a page to find local help. By entering your zip code into the box on this page, you're provided with a list of the navigators and other application assisters for your state. This screenshot shows the results of entering Chicago into the search box and then checking the box on the left for non-English language support. So as you can see that if you live in the Chicago area and you're looking for non-English language support, there are 228 organizations to help you do that. When I entered my my home zip code into the box and just checked the box for application assisters, I actually got 553 results. So if you do live in a large city like Chicago, there just are a lot of resources, or a lot of people out there to help you with the law or with the marketplace application. Health and Human Services, the HHS people have had a healthcare site that existed long before the healthcare.gov site was developed, and they still have some resources that you as librarians might find helpful. This site provides lots of additional information about the new law and is a good place to go for factual information. If you go to the facts and features page and you select the state by state, you get this map. This feature allows you to select a specific state to get more information about the number of uninsured people in that state who are eligible for insurance through the marketplace, as well as other demographic information. Here's another page that's out there somewhere that kind of summarizes enrollment options for people. You can enroll by online, or you can enroll by mail, by phone, or in person. There's a single application process to help people determine if they're eligible and to determine if they qualify for Medicaid or for one of the tax breaks that's going to be available under the new law. And for most people, the information that you need, the tax information or citizenship status that you need, can be verified by the federal government online. So for many people, the eligibility thing does take place in real time, because there are the website is linked to various databases. For example, the VA databases are linked to it, so that if someone is a veteran, they automatically can be confirmed as being a veteran. All right, now I'm going to switch over to some National Library of Medicine resources, since that's who I work for. This is, if for those of you who don't know about the National Network of Libraries of Medicine, let me first introduce this organization, which is the one I work for. We are funded by the National Library of Medicine, and our mission is to advance the progress of medicine and improve public health by doing two things: by providing all U.S. health professionals with equal access to biomedical information, and by improving public access to information that enables people to make informed decisions about their health. There are 8 regions in the national network, and you can see them on this map. We are located in the Greater Midwest region, and that is the office that I manage, and we're located here in Illinois at the University of Illinois, Chicago. Each of the regional libraries there is a regional library, which is known as an RML, in each of these regions, and the office is located in that regional medical library. In addition to myself, for example, in the GMR, in the Greater Midwest region, there are 5 other professional librarians who provide services to the 10th State region. We do teaching of classes and webinars. We exhibit at professional association meetings, and we provide one-on-one consultations to network members via phone, email, or in person through site visits to libraries in the region. The Greater Midwest region currently has about 1,100 members. And in case you're wondering, membership in the national network is free. So if you're not currently a member, you might want to sign up so that you can get access to our listservs and other resources. Oops. So here is, this is the page on the Greater Midwest Region's website that has information about the Affordable Care Act. Just wanted to point out that we do have a resource, and on this page we have separated information for each of our 10 states. So you're going to find information for Indiana, Iowa, Kentucky, Michigan, Minnesota, Ohio, North and South Dakota, and Wisconsin, all on this page. And we continue to add more information as we hear from people around the states in our region. My next slides will highlight a key resource that many of you are already familiar with, Medline Plus, but I will run through this quickly because there's really a lot of really good consumer health information available through medlineplus.gov, and if you're not familiar with it, you really should become familiar with it. Medline Plus has been online since 1998 and receives over 10 million unique visitors every month. It has a wealth of authoritative, reliable consumer-level health information. It has full functionality in English and Spanish, and it has select information in over 40 other languages. You will never find advertisements on Medline Plus, and everything on Medline Plus has been vetted and meets strict quality guidelines set up by the National Library of Medicine. Here are some of the numbers to give you an at-a-glance view of the volume and variety of content that we have on Medline Plus. Everything from an encyclopedia, drug information, herb and supplement information, a medical dictionary, interactive tutorials, anatomy and surgery videos. I'm sure you're all dying to watch a surgery video. And links to thousands of pages written and maintained by the National Institutes of Health and other government agencies such as CDC and other trusted health organizations. Medline Plus also has 951 topic pages. So you can actually find some topic pages that relate to the topic we're talking about today. Here are 5 examples. There is a topic page for health insurance, one for financial assistance, managed care, Medicare, and Medicaid. The topic pages provide the results of pre-formulated searches that have been pulled together, and that pull together links to all of the sites in Medline Plus that relate to that specific topic. All of the included sites have been selected with the same strict criteria in mind. When you type health insurance, for example, into the search box, it pulls up this page that lists more than 3,000 results. The first item on the list is generally a topic page that's been developed at the National Library of Medicine that gives kind of an overview of the topic. The health insurance topic page has an introduction followed by a Start Here section, and then 6 categories that NLM uses to divide up the search results. So there you can go and look for things basics. You can look for, there's a section called Learn More. There's videos and multimedia and cool tools where you can find videos. You can find the research that pertains to a given section, et cetera, et cetera. So lots of good information here. Here's another view of the health insurance page. this one is highlighted because it shows that you can enter in your email address and be on a list and get updates when something new gets added to the particular topic. So if you wanted to follow a particular health topic, you can get on a mailing list and get updates for that page. Now I'm going to move on to some other resources, starting with Get Covered Illinois, which is the official health marketplace for the state of Illinois. The Explore Your Health Coverage Options section has a step-by-step process to help you determine if you're eligible to buy insurance through the marketplace, through this page. The Get Help in Your Area section provides a phone number to call and a search box that allows you to enter your zip code to locate insurance navigators and application assistance within a set number of miles of your zip code. So when I entered my zip code, for example, I was told that there were 90 English-speaking navigators within 5 miles of where I live. I believe there are 10 other languages that are also available off of this site. The website provides navigator facts and tips for providing you and your family, for protecting you and your family, plus a glossary and a frequently asked questions section. Illinois Health Matters is an example of a health advocacy group in Illinois. This one is a source of information for healthcare reform in the state of Illinois for community groups to both effectively help their clients navigate the complexities of the Affordable Care Act and to safeguard their interests in shaping healthcare policy in the state of Illinois. They provide services to individuals, families, to small businesses, and to community organizations. Illinois Health Matters is a unit of the Health and Disability Advocates, which is an advocacy organization in Illinois. OCLC's Web Junction also has developed a program called Health Happens in Libraries to help libraries to find information about the new law. This project was funded by the Institute of Museum and Library Services, and it's primarily directed at public libraries, but it has useful information really for all types of libraries. They also have a place where you can sign up to receive updates about various webinars that are being given on the subject of the Affordable Care Act. Kaiser Family Foundation is a foundation in the U.S. It's a not-for-profit, nonpartisan, privately operating foundation headquartered in Menlo Park, California. Their health reform pages offer a wealth of consumer-friendly information on the Affordable Care Act. The most popular item is the Get Ready for Obamacare with U-Tunes, which is shown on this page, that provides an animated introduction to the Affordable Care Act and how it affects you personally. So if you're looking for something that might be a little bit lighter tone, they have a YouTube thing, an animated YouTube program that might be of interest. Tools like the health insurance subsidy calculator are useful for people to get a general idea about the premiums that they might have to pay and the tax credits that they might be able to receive. The current issues section has a series of webinars hosted by the Kaiser Family Foundation, and the current resources on health reform section has more simplified information and tools to help people understand the Affordable Care Act. Not surprisingly, AARP has a Health News Answers page where they talk about the new law. This is a toolkit that will help you determine your eligibility to apply for ACA. It's very easy to use and consumer friendly. The fact sheets, tools, and more section, along with the FAQs and the glossary, have useful information for that librarians might actually be able to use to help answer questions for their library patrons. Enroll America is another local Illinois, well actually I'm sorry, is not a local Illinois site, it's a national site. It's a 501c3 organization whose mission is to maximize the number of uninsured Americans who enroll in health coverage that's being made available by the Affordable Care Act. Enroll America accomplishes its work by engaging a wide variety of organizations with a stake in enrolling the uninsured in health coverage. Their partners include health insurers, hospitals, pharmaceutical companies, employers, consumer organizations, faith-based organizations, civic organizations, and philanthropies. They track the latest information on best practices for optimizing enrollment, and they share that information widely. They provide guidance and assistance to help states and the federal government adopt streamlined and user-friendly enrollment policies, procedures, and practices. They work to raise awareness of enrollment options among the uninsured and to broaden the range of channels through which uninsured individuals can enroll. Community Catalyst is a national not-for-profit advocacy organization that's working to build the consumer and community leadership that is required to transform the American healthcare system. It's been around since 1998, and it aspires to be a powerful consumer voice to ensure that all individuals and communities can influence the local, state, and national decisions that affect their health. This and Enroll America are examples of the kind of advocacy organizations that have been and will continue to work to improve the quality of health care in the U.S. One last example, this is the Maternal and Child Health Literacy Library at Georgetown University. They've developed a resources guides on health insurance for both professionals and consumers. These guides provide a great overview of the changes in the health insurance marketplace and where to go for more information. Their goal is to serve the maternal and child health community with accurate, reliable, and timely information and resources. They are part of the National Center for Education in Maternal and Child Health, which is based at Georgetown, has been based at Georgetown since 1982. Much of the funding for this resource is coming from the Health Resources and Services Administration of the U.S. government. So that I'm finding that I have sped through what I have for you rather quickly, and I should have one more slide here to say thank you, and I would be happy to entertain any questions that you may have out there. While you're thinking about questions, and please feel free to type them into the chat box where Kara will be able to see them and then probably relay them to me because I'm not seeing those questions on my screen. But before I do that, I just want to remind you that if you're not a member of the National Network of Libraries of Medicine, I urge you to join. Membership is free, and you can, as a result, you can sign up for our email announcement list, which is called GMR List, to find out what new resources and training opportunities are available from the National Network. Our website, as you see on the slide here, is nnlm.gov/GMR. And I have tried with this presentation to present a sampling of resources that are available, but as you probably all know, this is a moving target. So I may have missed some, and in fact, if there's anyone on the call who knows of a website that I may have missed, that's your favorite website, please feel free to put that in the chat box as well.
Okay. I do want to let you know that we will be posting the slides to the SLA Illinois website and hopefully an archive of the webinar. I do have one question here, Ruth.
Okay.
Do the federal resources pointing to local help information include those states that are running their own exchanges, such as Minnesota?
Yes, I think any of the states that have, or any of the websites that have like a map or whatever, if you click on one of the states that's running their own website, you will get directed to the website that's in your state. And my understanding is that Illinois is right now is referring people to the healthcare.gov website, but I think they are what's called a partner, in sort of a partner model, and I think down the road the enrollment is actually going to take place. There's actually going to be a state site for the state of Illinois. It's just not up there. During the first year or two of the law, they are directing people to the national healthcare.gov site, but I think that's actually going to change at some point, and Illinois will have its own enrollment site.
Okay,
and
great.
I didn't mention earlier that enrollment this year ends on March 31st of 2014. In subsequent years, though, the open enrollment is going to start probably in October or November, somewhere in there, and it's going to end probably around December 7th of the year for coverage that begins on January 1st. I didn't mention that earlier.
Great. So the next question is more about how to access the slides and the archive of the webinar, and that will be free on the SLA Illinois site. You don't need to be an SLA Illinois member to access that information, though we encourage you, if you are part of the Illinois area, that you join the Illinois chapter, but hopefully you're an SLA overall national member. And do we have any other questions? Feel free to type them in. Okay, perfect. Well, oh, we do. Will you send us a link to the slides with the survey afterwards? You know what? Yes, I will. I'll have Ruth.
Well, yeah, I haven't actually given Kara the final set of the slides yet, so I will do that today, and she'll try to get them up as
perfect
as soon as she can.
Yeah. So, and what I'll do is I will send a message when we post it to the site to everyone who attended this webinar to make it easier for them to know where to go on the site and when they can access, just so it gives Ruth a chance to send that information over to me and allow me to go ahead and send that survey out. But we do have lots of thank yous. So I want to thank you, Ruth, and thank you, everyone, for attending. And feel free to give us some feedback in the upcoming survey, and I think we will end the session.
All right. Well, thanks, everybody. This has been kind of fun.
Okay.
So I hope you learned something from it.
Perfect. All right. Thank you, everyone, for attending.
Okay.